Shalom. This is Gabrielle, and um, I am here at 12:30. I was experiencing some technical difficulties with my phone and had to hurry up and get to the house to get the laptop. So I am now on my laptop, and I'm going to give it maybe about 5 minutes before I go ahead and get started. This video, I do not plan on being very long. Because I do have a couple of other videos that I would like to put up today, pertaining to labor and pertaining to breastfeeding. So hopefully this video will not be long. And if it is not long enough for you guys, please feel free, like I say in every video, to type a question, email, message, whatever, comment with your question or your inquiry, and whatever I don't cover in the video, I will be sure to try to get back to you as soon as possible. First days are my very busiest days, or I don't like using the word busy. I would say my most productive days, because I have a lot of tasks on my agenda that has to get done. But then also, this is the only day where I can actually do more than one video. So first days more than likely will be the day that you guys see a lot more videos instead of during the week, because during the week it's kind of hectic just because we have homeschooling and business and ministry things that have to get done. So first days will be my number one day that I try to get out as many of my videos. So that is why this video won't be as long today. It's pretty short, simple, straight to the point. But if you do need suggestions on the few things that I'm going to make mention, type a comment. You can leave your email. You can shoot me an email. You can go to my Facebook page and contact me on there with your questions as well. And that way, because it's individualized, I can be able to what you're asking. So, yep, I'm going to give it about 2 more minutes to see if we have anyone else come in the view, and then I will get started. Bless y'all. All right, so I am gonna go ahead and get started. This video is what not to take during pregnancy. This is just a like I say in all my videos, this is just from personal experiences and from self-autonomy that has been used on my part as far as exploring natural alternatives to living a healthy lifestyle and developing healthy children within my womb. So these are just a few suggestions that I would like to put out there for you all, so that you can see that there is not just one option to being pregnant, to dealing with pain while being pregnant, to dealing with constipation, dealing with detoxification while being pregnant, dealing with cleaning, things of that sort while being pregnant, because there are certain things you do want to avoid, while you're with child, just to protect you and baby. And a lot of these things aren't really talked about, especially in the doctor's offices. This information I had to kind of learn on my own from, schooling myself and from just firsthand experiences. So, turn my camera back on. Hi, shalom. I'm here, and it's not in a specific order, but this is just what I had written down. But of course, one of the main things is you don't want to take prescription medications while you are, while you are with child or pregnant, whatever terminology you want to use. Medications that are prescribed to you, if you look at the side effects, it's not good for you. It's not going to be good for baby. And most medications are synthetically derived. They're chemical based, and it's going to throw off the pH balance of your system completely. It's also going to cause a buildup in yeast within your system as well, which will cause you to feel sluggish, which will cause you to feel sick and groggy. You'll feel out of place, and you really can't explain why you feel that way. It's because of overload of all of these synthetic drugs that are being pumped to us. I know with my first pregnancy with my eldest son, I dealt with nausea. And they try to prescribe me this medication that would stop the nausea. But the side effect was vomiting and nausea. And I thought that was so funny. So it was, things like that happened to me. I'm like, what? You're giving me a medicine that's supposed to stop the nausea, but the side effect symptom is nausea and vomiting and constipation. So I was trading in one for 3 more symptoms that I didn't need. When in all actuality, all they needed to tell me was, okay, Gabby, you need to increase your water intake. Well, my water was good. So what they should have said was, okay, Gabby, you need to cut out fatty foods. No more French fries, no more fried chicken. Because with my first son, I had fried chicken every night. I just wanted fried chicken. I didn't have cravings. I just loved fried chicken. So now I'm on my 6th pregnancy. So I know better. I know my body a lot better than I did before. And I know that greasy foods, just saturated fats, anything, any type of fried anything, it throws off my pH balance in my system. I know now that my body has to stay more alkaline for me to feel like I'm not even pregnant. Once I start feeling kind of icky, I know that I'm overly acidic. And let me show you what I do. I'm sitting right here. I can go ahead and grab it. But what I normally do, and I just test myself. And that's how I've gotten good, where I know now when it's a certain feeling that I get. Hold on, let me grab it. A certain feeling that I get to know that I'm acidic. And this is how I know. This is what I use to test myself. It's pH strips. I don't know if you can. There you go. You should be able to see it. But when I start feeling really ill, like I can't really explain. It's like you're not sick, but you feel like I can't explain it, but I know I don't feel well. And when I start feeling like that, I'm like, okay, I'm acidic. What did I eat? What didn't I eat today? Or how many days have I eaten something along the lines of below pH 6.5? And you can see here, 6.5 is like right here. Here's 6.4. 6.5 is in between here. You see how it's like kind of starting to turn yellow? This is where you want to be. So for me to feel like really good, like I'm not pregnant, I'm not waking up with mucus in my nose that needs to be blown. I'm not waking up with mucus in my throat where I feel like I'm a gag. My body pH is here in this bluish, it's like a bluish green color. I'm able to, I really don't have to do it now. I just know. I can tell when my body's off balance. And then I'll just probably do a strip just to confirm, yep, your body's off balance. And so this is what I normally use. And this helps me. This helps me a lot. But a lot of the times is because your pH balance is off. It's out of whack. So medications that doctors prescribe to you, it will do that. It will cause an overload and yeast in your system. My recommendation is if you have to use a medication, it better because I said that backwards. It better be because it's a dire situation, like it's life or death. That's the only time that medical intervention, I believe, is necessary. Because outside of that, we're actually causing gaps in our body and opening up access for sickness to come when we're taking medications that's doing nothing. It knocks off the body's natural ability to be able to heal and recuperate and renew and restore itself. The Father created our bodies in a perfect manner, a perfect way where it's smart enough to know what to do to heal itself. He's also given us vegetation, herbs of the field to be able to work and coincide with our body, that our body can identify to natural substances. So, that's what this video is going to kind of be about, is about being, using natural substances that your body can identify with. Your body is a very smart mechanism. I don't know. I'm trying to find some word. It's a very smart, intricate design that the Father has made, where it speaks and it knows what to do. It knows what to say. It knows what to kick out. It knows what to take in. And so with medications, when it enters into your body can identify what that is because it's synthetic. So what normally happens is when you take medications into your system and your body takes it and is trying to process it, it's like, this isn't natural. I don't know what this is. This is man-made. Anything man-made and not natural, the body is going to take it as fat. It's going to take it as fat or a foreigner. a foreign invader. And so what happens is if it can't identify it, it just takes it and it pushes it into your fat cells. It pushes into the adipose tissue. And so then what happens is, okay, now you've got toxins building up in your system because you continue to put this medication in or these foreign substances. You know, sugar is a drug. It's so foreign, your body cannot identify what it is. And so what happens is it just, all right, that goes over here. It's not a carb. It's not amino acid. It's not a herb. It's not this. It's not that. It's not nothing natural. So it doesn't know what to do with it, but store it into your fat tissue. And so over time, you get sick. So please avoid medications if you can. If medications are needed, try to seek the most natural, alternative as you can. There are some natural herbs, natural oils, natural plants that are not good for you to use during pregnancy. And I'm going to tell you which ones not to use during pregnancy. But there are some that are very safe for you to use for constipation, for detoxing your system, for pain relief, for fatigue. There are natural sources for all of those types of things. You don't have to run back and forth to the hospital, run back and forth to Walgreens, CVS, what other store, or as a pharmacy. You don't have to run back and forth to these places. You can just actually go to the grocery store, go to your local Whole Foods market, and you can find these things that will help you. So, pain, a natural remedy or a natural substitute for pain, especially if it's like localized pain, say toothache. I would get toothaches after my first son because I had gotten a broken tooth, and I had to wait to get my tooth pulled because I'm pregnant. Well, I know better now. I ended up getting my tooth pulled, and I didn't use any pain medications at all. What I did use was clove oil, and that is a natural essential oil, or you can get the herb and you can soak the actual cloves, the clove buds. It's not clove garlic. Not clove garlic. Don't get that confused. There's a clove garlic and then there's a clove bud. Clove bud is like a flower. So for pain, for localized pain, like in your mouth, on your, in this type area, you can use clove bud oil. But more so like for your fleshy parts where you're having pain, clove bud oil is a good substitute. It is a very strong, pungent oil. So you do want to make sure that it is diluted. Clove bud oil works very well. You only need a drop. Like I said, I got my tooth pulled and I didn't use any of the Tylenol 3s, the Vicodins, whatever they normally prescribe to you during recovery from getting root canal or getting your wisdom teeth pulled. I didn't use any of that. All I had was clove oil, olive oil, coconut oil, and some Q-tips, and pain alleviated instantly. If you have an abscess, if you have sore, swollen gums, gingivitis, periodontal disease, what else? Broken tooth. If you have cavities, any type of mouth issues, lockjaw, your mouth is hurting, clove oil, put it on there. There's actually an amount that you want to do. So like I said, if you need information on how to go about preparing that and using it, comment and I can get that information to you. Okay? Because you want to make sure that you're doing things where it's not too much. and it's not going to hurt you or a baby. You can overdose on anything. You can overdose on water. Okay. So you want to make sure you have proper instructions when you're doing anything. These are just tips. So if you need instruction on how to use the tips or go about incorporating the different methods that I do in your life, ask me. I will make another video giving you instructions, or I will email you personally and give you instructions. Okay. So for like localized pain in the body, sore muscles, tummy pain, knee pain, you hurt yourself, pain like that, arnica. They have arnica pills, which you would get on the homeopathic side. So if you go to like your natural grocers, places like that, you can get arnica, and they come in like 20x, 30x, 60x, sometimes 100x or 100C. They'll just, when you go to try to get it, they'll describe to you which one you actually need, because the X and the C, they're two different types. You have one type of arnica that's for trauma, like immediately traumatic pain. And then you have another type, which is for like a minor pain. So for like tooth pulling, a trauma type pain, you want the extra strength. If it's not trauma type pain, then you don't want the extra strength. And so that's what the X and that's what the C represent. It's a differentiation on what is the strength level that you need. And when you go to the Whole Food store to get it, there will be somebody there to help walk you through. You just tell them, okay, this is what I'm dealing with, and I need arnica. Okay, oh, well, you need 100C, or, oh, okay, well, you need 60X. Okay, so they'll be able to help you as far as that goes. So you can get the pill or the oil. I use the oil right now. And when I use the pill, I normally use the pill after labor. So like after birth, those couple of days when I am healing from having the baby, I use the arnica pills in conjunction with my afterbirth tincture. So there's just different methods and different ways that you can use the natural pills and the natural oils for pain. Like I said, if you need understanding, or you need me to answer specific questions pertaining to your dosages, how many times a day you should take it, feel free to email me or comment below. Okay. So, hallelujah. Next thing is cleaning. I know for me, I clean a lot because I have this saying, if I can't smell the bleach or the Lysol concentrated, not that spray. Lysol concentrated is like a liquid. It's a medical grade. It's what they use in the hospitals to clean. If I can't smell those, then it's not clean. So when I'm pregnant, it's like my senses are like, it's not that, like, I have to really smell it. I can't. So because I clean so much and I use chemicals, I want to urge you guys, please wear gloves at all times. All times. I don't care if you're just spraying just a little bit and you need to wipe something up. I am only telling you this because I did not wear gloves all the time. Thank the Father that my children are fine. They came out healthy as healthy can be. But I suffered. My body suffered from a chemical burn. And it took about 7 to 8 years for it to heal completely. Thank the Father, He healed me. If y'all don't believe that, this is my personal belief. I believe, and I know that the Father healed me of the chemical burn, but I suffered. In Jesus' name, I was healed. I suffered for 7 years with this chemical burn. And I don't know if you can, It's cleared up. You used to could see the scarring from my chemical burn, but you probably can't see it on camera. But I have that scarring as a reminder to wear gloves all the time. So it's very crucial. It's very important because I had to go through it, and it was not a pleasant experience. I mean, feeling fire. It literally felt like fire on the inside of my hand, just working its way up. And it would be there. No, ma'am. Is that mommy's? Mm-hmm. What is it, baby? It's bread for you. No, baby, that's yours. Okay. It's mine. Go ahead. Shut the door. Okay. My daughter fixed a peanut butter jelly sandwich. This is for you, Mama. I don't eat peanut butter jelly. So, hallelujah. Bless her little heart. She's so sweet. I never thought I would have a girl. Just, that was a side comment, side note. All right. Please. Chemical burns are not fun at all. And your system is very sensitive while you're pregnant. So you want to make sure you're wearing gloves at all times. And if you can avoid high fumes from the bleaches, whatever detergents that you use to clean with, if you can use a natural alternative, tea tree oil is very good. Hyssop essential oil. When I say oil, I'm meaning essential oils. So tea tree essential oil, hyssop essential oil, cajeput essential oil. And then you have your essential oils that are antibacterial, antiviral, antifungal, and antimicrobial. Those are the ones that I really recommend. So you'll hear me talk about them a lot, especially in my next up and coming videos. Tea tree oil is a essential oil that is antibacterial, antivirucidal, fungicidal, and antimicrobial. They will kill bacterias, viruses, microbes, and funguses. Those are the type of oils that you want to use when cleaning. 300 times better than bleach. 300 times better than your, the normal things that we buy in the store to clean with. And I say that because most of the things that we buy in the store to do our cleaning with, they only kill bacteria and they only kill viruses. Okay. So anytime you come across something that kills more than bacteria and viruses, you want to use that instead. And so your essential oils that are good for cleaning almost every type of bad foreign invader that would be harmful to your system and your baby system. Thyme essential oil. That's THYME. Thyme essential oil is like number one on my list. That is essential oil that I recommend that every mother, every household have, because it is antiviral, antibacterial, antifungicidal, antimicrobial. I recommend that. Vetiver, I also recommend that as well. Vetiver, if I'm not mistaken. And you know what? I think I'll do a video specifically on those types of oils, especially because it's like cold and flu season, and a lot of people are going to be getting sick and passing viruses and bad bacteria and all that stuff. So I'll do a video specifically showing you which essential oils that are key for your home and key for mommy's first aid kit. I also make mommy first aid kits. So if you're interested in getting anything like that, you can let me know and I can get the information to you. I can make a video on that as well. Just so many different things. So please ask me, remind me, and I can make a video on it because there's so many different things I can speak on. But my mind, I only remember when I'm asked. So thyme essential oil, number one. The next one is oregano essential oil. Number two. Now, the thing with oregano essential oil, don't take it as often as you take the thyme essential oil. Oregano essential oil is just like, It's the equivalent of what antibiotics are designed to do, but it's natural and it's healthy. Okay. The reason I say that is because the oil not only kills bad bacteria, but it's so strong it can kill off a little bit of the good bacteria too. It targets bacteria. So in an emergency situation, I would use oregano essential oil. But for maintenance and to keep yourself from getting sick because someone else is sick, thyme essential oil. Okay. Both of them, they smell alike. They both smell the same. Their potency is about the same. But oregano is a lot stronger than the thyme essential oil. Both of those oils can be used for cleaning substances as well. And I make my own disinfectant spray. I make my own hand soap. Because like I said, the only thing that's sold in the stores is antibacterial and virucidal. So that means that I'm still susceptible to protozoa. I'm not sure if I said that correctly. Protozoa. I'm still susceptible to colonies of microbes. I'm still susceptible to funguses. And I want to wipe out everything. And so this is why I make my own. And if you're interested, let me know. But those are very important. And that was for the cleaning portion. And then a lot of people like to detox. I know for me, I have to detox because when you're pregnant, you take on so much gook in your system. Pregnancy causes constipation, and then it's just your body is going through a lot of different changes with the hormone imbalances and things of that nature. And so once you have baby, it's like, now it's time for a detox. That's what I used to think. I can actually detox while I'm pregnant. Okay. I don't use the detoxing cleansers that they normally have on the supermarket or laxatives that they give you. I don't use any of that. The safest thing to use right now during pregnancy, you probably already know what it is, but you just didn't know. Activated charcoal. Okay? Activated charcoal. Not the charcoal that you grill with. For some of us who may not know exactly what that is, but for the those of us who do know what activated charcoal is, you can use that while you're pregnant as a detox. Okay? And what I normally do is I take about a tablespoon. I take between 2 teaspoons to a tablespoon a day. So I can take like 2 teaspoons in the morning when I first wake up, and then before I go to bed or in the evening after dinner, I'll take another 2 teaspoons, 2 teaspoons and a half. Sometimes I may take 1 teaspoon before lunch area. Like when I feel myself getting hungry, I'll take the activated charcoal. So that way, at least 10 minutes, it's able to go ahead and encapsulize whatever toxins, bacteria, foreign substances, foreign invaders, foreign inhalants that I've inhaled. It can go ahead and get all that stuff right before I eat. So activated charcoal is something that you can use. It is ingestible and it works very well. It will not cause constipation. It will actually help you if you are constipated during pregnancy. So charcoal, activated charcoal is good for helping you detox if that is something that you're still concerned about while you're pregnant. Okay. So activated charcoal is really good for detoxification. Now, these are things that you want to avoid along the lines of herbs. And then I'm going to give you the essential oils that you want to avoid. And forgive me, I'm looking down because I'm looking at my notes, making sure I say everything that I have on here. Okay. So these are the ones you want to avoid, and then I'll let you know the oils that you can use while you're pregnant. And I am getting hungry again. This is the story of my life right now. I get hungry like every hour and a half. It's so funny. It doesn't matter what I eat. I'm hungry in like another hour and a half. It's my husband. It's his genes. Because, oh man, we produce massive children. For my size, I'm very small. I'm very petite. So I'm like, geez, you got these strong genes. I'm like eating every hour and a half. All right. Avoid laxatives. Do not take any laxatives during pregnancy, especially late in pregnancy. Once you hit your 7th trimester, try to avoid anything that is going to make you go to the restroom. If you have trouble using the restroom, distilled water, that will help you use the restroom. Distilled water, because it removes everything. Just make sure that you're still getting your nutrients in throughout the day, because you're going to have to replace that back after drinking the distilled water. But distilled water, sometimes a lot of women are constipated because they're dehydrated. If you stay hydrated, you shouldn't have any issues with elimination, for the most part. But if you are hydrated and you're still dealing with constipation, okay, then that means that we're having a little bit of vitamin deficiency as well. Or we're having a vitamin overload. If you're taking too much iron, that'll give you constipation because you're not balancing it out. So, but if it's anything other than that, drink distilled water. Okay? No laxatives. These are herbs that will cause you to go to the restroom. You don't want things that will cause you to go to the restroom because that activates and it jump starts labor. Okay? Slippery elm. No. That is a number one no. That will cause you to lose your baby. Okay? Do not take slippery elm. I don't care how early in the pregnancy it is. I don't care in the middle. I don't care towards the end. If you take slippery elm, you're going to go into labor. Okay? I do not recommend you taking slippery elm. That is very good for you outside of pregnancy for constipation. Once you're pregnant, you cannot use that as an option to help you with constipation. So if no one's told you that, I'm telling you, please do not take slippery elm powder, slippery elm herb, nothing slippery elm. Okay? Pennyroyal, same thing. Do not take that. It will cause you to have the baby. Okay? Avoid pennyroyal. I don't care pennyroyal tea. No, none of it. Don't take it at all. Flaxseed. Once you get late in pregnancy, so let me see, your ninth month, or if you are prone to have your children a lot earlier, do not take flaxseed. Kind of come off the flaxseed. You can just use the oil. Use the oil on your perineum. Other than that, no flaxseed, okay? Because that will cause you to have baby too. All of the things that I'm mentioning, like, induce you to use the restroom a lot, and that will cause you to go into labor. Okay, so no flaxseed at that that month you're trying to keep baby in. No flaxseed, no castor oil, no Seneca. Seneca is a herb. Seneca. Don't take it. It's you. Don't do it. Okay. Catnip. Avoid catnip as well. It does the same thing. These are all the ones. All these herbs do the same thing. Do not take them. Centaury. That's Centaury. I could be pronouncing it wrong. That's why I'm spelling it for you. These are herbs that you want to avoid. Clary sage, essential oil. It smells so good, guys. It really does. Using that. If you're going to use clary sage oil, you better already be in stage 2 of labor, pushing. Like you're getting ready. Labor's already started and you want it to continue to progress. Okay, now you can use clary sage oil. Okay, that's the only time you can use it. Other than that, don't smell it. Don't rub it on as perfume. No. Avoid clary sage oil because that will induce you. That will cause preterm labor. Okay. Oh, Father. Okay, sitting on this floor. Okay. These are some other oils. It's like a whole list of oils. Some of these you probably have never even heard of. But these are oils and herbs. Like I said, some of them you've probably never heard of, but I'm going to name them. Okay. And you can always go back and listen to the video again. If you are inexperienced in any type of herbal oils, plants, teas, things like that, please avoid it. Okay. Please avoid it. Avoid basil. These are the oils. This is concentrated. I'm not saying you can't go eat basil. You can eat basil. But the concentrated oils, which is essential oils, avoid it. Okay. Marjoram, clary sage, myrrh. Okay. It smells so good. But if you're inexperienced, avoid these. Okay. Sage, hyssop, yarrow, mugwort, wormwood, davana, boldo. That's BOLDO. Atlas or Himalaya cedar. Okay, so it's probably Himalayas, which is the botanical name, or it says cedar atlas. Avoid it. Okay, Massoya, MASSI. Oh wait, MASSOIA. Okay. Like I said, some of these y'all probably never heard of, but I'm going to say them just in case you end up hearing about it. Curcuma, CURCUMA. Nagarmotha, NAGARMOTHA. Eucalyptus dives, Eucalyptus globa. Babies. Eucalyptus polybricata. Okay, that is the botanical name, but it says eucalyptus. If you get a cold and you're congested, you can put a little bit of eucalyptus in a humidifier. You'll be fine. Don't try to use this on your body. Don't try to do anything like that. Fennel. Phokinia. I probably need to spell that for you. FOKIENIA. Geranium. Helixrium. Hops. You know what hops is. If you don't know what hops is the flour that they use to ferment and make beer. Okay. Hyssop. I think I already said hyssop. Anise. Lantana. LANTANA. Lavender stolaceous. Cajeput nioli. Nioli is NIAOULI. Don't get it confused with neroli. Okay. They're two different oils. They just sound similar. Mentha arvenis, peppermint, spearmint, parsley, ravensara, rosemary, verbena, clary sage, santolina, SANTOLINA, tagetes, TAGETS, Tansy, Thuya, which is Thuya, pennyroyal, which I just may mention, and dill. So this is a combination between herbs and essential oils. These are the ones that you want to avoid during pregnancy, especially the ones that I may mention. Some of these on here, let's say if you are not experienced, if you're inexperienced dealing with herbs and plants of that nature, these are things that you definitely want to avoid. Okay. I think these are some oils that I didn't mention. Bitter almond. I said the Boldo leaf. Calamus, horseradish. Jaborandi. Jaborandi. Jaborandi leaf. Mugwort. Mustard. Pennyroyal. Rue. Seraphrase. I said that wrong. Sassafras. Sassafras. That's an herb that you hear about a lot. You want to avoid that while you're pregnant. Savin, Savin. Southernwood, tansy, thuja, wintergreen, wormseed, wormwood, and yellow camphor. Okay? These oils on your body. Aniseed, basil, bay, birch, black pepper, cedarwood, cinnamon, clary sage, clove, fennel, hops, hyssop. Now, I said clove, but like I said, you want to ask me for small amounts on how to use that for your pain, just in case you have jaw problems, tooth issues, teeth issues. I am experienced with these herbs and oils, so I can give you a specific dosage that you can use this in. Okay. But like I said, these are things that I'm mentioning for people who are inexperienced. You don't really know much about essential oils. You don't really know much about herbs. You only really know kind of what someone shared with you. If you're inexperienced, don't use these things. Okay. Like, don't just go to the store and be like, oh, I'm going to use this. Okay. That's not wisdom. That's not wise at all. Yeah, most of these are, I already said, cumin, fennel, hops, hyssop, juniper berry, mace, MACE, marjoram, myrrh, nutmeg, oregano, parsley seed, pimento berry, rosemary, sage, spikenard, tarragon, thyme, red valerian, yarrow, and wintergreen. Again, these are the extra strength concentrated oils. It's not the food. You can eat the food. It's just the oils, okay? This is what you can use. You can use Roman chamomile. You can use lavender. You can use geranium, mandarin, rose, tangerine, lemon, cardamom, petitgrain, and rosewood. Those are oils that you can continue to use during pregnancy. There's a lot more that you can continue to use, but I just wanted to give you just those little bits. They're very good for massage, especially lavender and Roman chamomile. They create a relaxation feeling over your body. So it allows you to relax and relieve any stress if you've had any from any type of environment that you were in that day. So those oils are very good for massaging. And also for aromatherapy. So if you like smelling oils that smell really lovely, those are some good oils to blend together. And that is all that I have as far as what to avoid during pregnancy. I hope and pray that that was informative for you guys. And if you have any questions, comments, or concerns, feel free to leave a comment below, or you can email me on Facebook or email me direct if you have my email. Bless y'all, and be looking forward to the breastfeeding video shortly. Shalom.